it's Dr. Hapchyn at Elm Tree Clinic. This video is about toxic stress. To sort out whether stress responses are adaptive and healthy, or whether a person is stuck in chronic toxic stress, we need to monitor the intensity, frequency, and duration of each type of stress response. When we are observing children's stress responses, it's important to understand that what is considered adaptive and healthy depends on a child's level of development. Infants and younger children have more immature nervous systems. They can't control their stress responses with language and thinking. Young children may have more frequent, intense, and longer stress responses than older children. They need more help from caring adults to calm stress responses and get back to the green zone. I will describe each pattern in detail now. Keep in mind that we need more research to determine the specifics of these patterns. However, these 4 toxic stress patterns are useful to describe when stress responses are not adaptive. Remember that we are including all 3 stress responses, red, blue, and combo. The first pattern refers to frequent, quick, or too intense stress responses. Does the stress response happen too frequently during the day? Does the stress response happen immediately when a person is presented with a stressor? Sometimes we use the phrase 0 to 100 to describe this escalation in intensity. In a healthy, mature nervous system, there are smooth, more gradual shifts between stress responses, and the intensity matches the context and the level of threat or challenge the person is experiencing. The second pattern refers to tricky transitions. Is there a daily transition the child ought to have gotten used to by now, but still is flung into a stress response by? For example, a 3-year-old who cries or shuts down on the way to preschool every day, even though it's been months, may be in toxic stress. Or a child who always gets angry when they have to transition from a preferred activity to a non-preferred task. The third pattern refers to stress responses that are too long. Does the stress response last a long time even after the challenge or threat has been removed? For example, is one still irritable in spite of a conflict being resolved for a long period of time, or still anxious even though a test is over? The fourth pattern refers to poor stress recovery. This is the worst type of toxic stress pattern, and it happens when a person is unable to adequately recover back to the green zone. The person is in a stress response of any color over long periods of time every day. Pattern 4 often includes disrupted sleep cycles as well. We are estimating that if the person spends less than 20 to 30% of the day in the green zone, then they may be in this pattern. We use the example of an elastic band to describe stress responses, stress recovery, and toxic stress. When you stretch out an elastic band, you stress it. When you release the tension, the band gets back to its original shape, and you can use it again the next time you need it. However, if the elastic band is repeatedly stressed or held in tension for too long, it loses its flexibility and gets worn out, or even may break. It doesn't work well anymore. With chronic toxic stress, the same thing happens in our bodies, and we can become physically and mentally unwell and at risk for illness. Here are the 4 toxic stress patterns in another handout. We are showing sleep in the bubble around the 4 patterns to indicate that poor quality and quantity of sleep put us at risk for all 4 patterns of toxic stress. So it's important to evaluate sleep carefully and treat sleep problems. When we have enough sleep and good quality sleep, this gives the autonomic nervous system, or our automatic nervous system, its best chance to function well during the day to maintain the green zone. Thanks for watching, and if you want the handouts, they're available at the Elm Tree Clinic website.